Now, I can only speak about this from my own experience and what I've experienced having OCD and fibromyalgia. They have to be the most debilitating conditions that I suffer from. So having OCD is a psychological condition, which for me revolves around cleaning, symmetry and rituals. And when I say rituals, I mean routine. Now, before you all come for me, which I've done in the past, I understand that OCD is not just about cleaning. It's got a lot of layers to it. As I've said before, just because it doesn't present the same as yours or somebody that you may know, don't mean to say that person doesn't have it. I've been diagnosed with it. So for me, my OCD, majority of the time, controls my life. So I've got 3 children, my house does get messy. And in my mind, right, it's messy, we need to clean it, we're getting it done. If I can't get up and do it, I've got anxiety. And the only way to relieve that anxiety is by cleaning it. So while I'm cleaning, it's relieving the anxiety and I feel better. Now, let's say that I can't do it, and I'm going to talk about fibromyalgia in a minute. Let's say I can't do it. I have panic attacks, severe panic attacks, to the point where I feel in that moment I'm going to die. Now, I know from a panic attack you can't die, but in that moment, while you cannot breathe, you feel like you're going to. Now, you're going to know if you suffer from OCD, that feeling that you get when you can't do it. It's not really a feeling that I can explain, but if you know, you know. And this is where it flips for me. Because having fibromyalgia, when you are it's a chronic pain condition, by the way, when you are in severe pain, you can't do it because you physically cannot get out of bed. You cannot move. So again, I'm going to say I've got 3 kids, the house gets messy. And what do you do when you've got 3 kids making mess? You're physically unwell, cannot get up out of bed. The house is going to get messy. So you've got all them feelings that you feel with your OCD, and then you can't physically get up and do it. For me, it then leads to my anxiety being absolutely sky high. I'm constantly having panic attacks. And then I start to feel depressed. I've got depression as well. Now, my feelings are quite strong, very, very strong. I don't know about anybody else who suffers with mental health problems, that having all of that be going on, it can then lead to feeling suicidal. Because you've got this psychological condition that's telling you to get up and do it, and then you've got this physical condition that you can't get up and do it. And then feelings, guys, them feelings are just, I can't explain it. And then it stays for as long as you're going to be in that flare, which we all know if you suffer from fibromyalgia, it can last weeks, months. You're lucky if it only lasts days. So going back to the original comment, I just don't feel like it's something that you can explain to people. Putting it in a nutshell, you've got a psychological condition that is telling you get up and do, and then a physical condition that's saying, hun, sit back down because you're not doing it.